A patient of chronic bronchial asthma maintained on oral prednisolone 20 mg daily and inhales salbutamol as required develops chest infection. Which of the following measures is recommended? No change or increase in prednisolone dose. Corticosteroid therapy is practically mandatory in the following condition: renal transplant. For limiting cerebral edema due to brain tumor, the preferred corticosteroids are betamethasone or dexamethasone because they do not cause sodium and water retention. Along with effective antimicrobial therapy, corticosteroids are indicated in the following infective conditions except herpes simplex keratitis. Systemic corticosteroid therapy is not used routinely and is reserved only for severe cases of acute rheumatic fever. The following adverse effects of corticosteroids is mainly due to their mineralocorticoid action: rise in blood pressure. Which of the following bone is affected more by glucocorticoid induced osteoporosis? Lumbar vertebra. After chronic systemic therapy, withdrawal of corticosteroids should be gradual because abrupt withdrawal may reactivate the underlying disease. The following measure can minimize the pituitary adrenal suppression during long-term corticosteroid therapy. Use of prednisolone on alternate days. Prolonged testosterone therapy can cause atrophy of interstitial cells of testes. Conversion of testosterone to dihydrotestosterone by the enzyme 5-alpha reductase is required for the following actions except spermatogenesis. Testosterone therapy started in a boy of 8 years and continued till puberty is likely to reduce adult stature. For the treatment of hypogonadism and impotence, testosterone or dihydrotestosterone can be administered by the following route: both intramuscular and intradermal. The following androgen does not produce cholestatic jaundice as an adverse effect: testosterone propionate. Select the disorder in which methyl testosterone is beneficial but testosterone is ineffective. Hereditary angioneurotic edema. Parenteral testosterone therapy in a boy can cause the following adverse effects except cholestatic jaundice. Choose the correct statement about anabolic steroids. They are androgens with relatively selective anabolic activity. The following is not a legitimate indication for the use of anabolic steroids: to enhance the physical ability of sportsmen. Danazol is used for the following disorders except amenorrhea. Danazol produces the following side effects in premenopausal women except menorrhagia. Select the drug that primarily reduces the static component of urinary obstruction in benign hypertrophy of prostate and takes more than 3 months to exert its beneficial effect: finasteride. The following drug has potent antiandrogenic and weak progestational activity: cyproterone acetate. Which of the following is a non-steroidal antiandrogen that is palliative in advanced carcinoma prostate when combined with a GnRH agonist? Flutamide. Circulating testosterone levels in men are elevated during treatment with flutamide. Which of the following is a steroid 5-alpha reductase inhibitor that has been found useful in benign prostatic hypertrophy and male pattern baldness? Finasteride. Finasteride acts by lowering circulating as well as prostatic dihydrotestosterone concentration. In patients with benign prostatic hypertrophy, finasteride exerts the following actions: reduces size of the prostate gland and increases peak urinary flow rate. Estrogens exert the following actions except maturation of Graafian follicle. Estrogen therapy in postmenopausal women has been implicated in increasing the risk of the following disorders except osteoporosis. Metabolic actions of estrogen tend to cause the following except rise in plasma LDL cholesterol.